Hello, and welcome to our ongoing series for Spectrum Health COVID 19 vaccines and our communities. We appreciate you joining us for this event. I welcome our audience and our panelists. My name is Dr. Lisa Lowry. I'm Section Chief of Adolescent Medicine at Helen DeVos Children's Hospital, Spectrum Health, as well as the Assistant Dean for Diversity and Cultural Initiatives with Michigan State's College of Human Medicine. I'm going to turn it over and introduce our speakers and our panelists. So let me start with Dr. Talonda Bragg.
Hi, Lisa. Dr. Lowry. My name is Dr. Talonda Bragg. I'm an internal medicine hospitalist here at Spectrum Health. I'm also the director of the internal medicine residency program, and I'm really happy to be here. I really appreciate this opportunity to come and connect with the community virtually. So thanks for having me.
Thank you. Next panelist, Mr. Maurice Burton.
Oh, good morning, everyone. I'm Maurice Burton, a 31-year state trooper, retired now, a community service trooper in the Benton Harbor area community. And I also sit on the board of Boys and Girls Club, Genesis Outreach Development Center, and a number of other boards. And I'm the co-pastor of Refreshing Fountains, and it's a delight to be on board this morning with everyone.
Thank you, Mr. Burton, and thank you for your 31 years of service. Our next panelist is Pastor Jaime Cervantes.
Hello, Dr. Lowry, and thank you for having me as well. So I am the pastor at the First Church of God in Benton Heights. I'm a transplant from Southern California. I'm originally born and raised in Los Angeles, and I've been calling Michigan my home now for 2 years. Aside from being the pastor at the church, I'm also a board member of New Heights CCDA, and I am just humbled to be on this panel to talk about this very, very important issue.
Thank you for joining us. Our next panelist, Reverend Dr. Howard Earl.
Good morning. Thank you, Dr. Lowry, for this opportunity. I pastor New Hope Baptist Church in the heart of Grand Rapids, Michigan. And this conversation is so important, especially for our residents and communities of color. And so I'm just here to lend my voice to this very critical conversation in our country, even in our world.
Thank you for joining us, Reverend Earl. And our rounding out our panelists is Dr. Lynn Todman.
Good morning. My name is Lynn Todman. I am Vice President of Health Equity at Spectrum Health Lakeland, where I oversee and drive the health equity portfolio of our hospital system. And I'm also a city commissioner for the city of St. Joe, and I sit on the board of a community bank.
Thank you. Thank you all. So we have such a dynamic panel and looking forward to a great conversation. We are so glad that you all could join us to discuss a topic that communities and healthcare providers are facing during this COVID-19 pandemic, and especially during this vaccine phase. As many of you know, last week, Governor Gretchen Whitmer expanded vaccinations to the first public phase, and this phase includes individuals over 65 and essential workers. We'll be sharing a link at the bottom of this screen for folks who want to know more about scheduling a vaccine. Now, for this discussion, we want to have a community discussion about COVID-19 vaccines. And more specifically, we want to hear from our panelists and our community and our audience about how we can build confidence in the vaccine, especially among our Black, Latino, Hispanics, and underrepresented communities. We all know that people of color and those in underrepresented communities have taken on a disproportionate burden of COVID-19 cases, deaths, and hospitalizations. And we all know someone that has been impacted personally by COVID. We as a community and our community members, as we help them make the best decision about getting the COVID-19 vaccination and their care, we here at Spectrum Health commit to sharing facts and information to aid you in your decision-making process. We also commit to being a healthcare institution that you can trust, where you'll be listened to, respected, and cared for. As a Black woman and as a physician, the vaccine represents a blessing and a path back to normalcy, also saving lives, and where we can open our schools and our areas of faith and how we interact in the community safely. So we want to definitely hear from you, and we want to hear how we can do better and protect people of all races and ethnicities during this pandemic. So I'm going to begin with our first panelist, Dr. Talonda Bragg. Dr. Bragg, you are a recipient of the vaccine, and please share with us your experience and how that has shaped your narrative to your friends and family about the importance of signing up and getting vaccinated.
Absolutely. Lisa, you are correct. I totally agree with you in that I saw the vaccine as a blessing and a privilege to be one of the first groups to be able to receive it. So I want to tell people a little bit about my vaccine experience. Today, actually, is 1 week from my second dose of the Pfizer vaccine. So the first vaccine that I got now a month ago, I didn't have many symptoms at all. Everybody gets the arm pain. I definitely had that. But some of the more significant reactions that signal that your immune system is working, like low-grade fevers, body aches, chills, I didn't get any of that. So it was really smooth sailing. So when I got my second dose, I did feel a little bit more. The first 24 hours, nothing, just the usual arm tenderness. But then I had a slight headache and maybe some little chills, but took some Tylenol, it was done with. I'll tell you, my experience is a little different, and there is a range of reactions that people can have, but they are absolutely normal, completely transient, meaning they go away very quickly, and it totally beats being at risk for COVID. So I'm also happy to report that my husband teaches driver's training, and he got his first dose of the Moderna vaccine today. So as a household, we will be protected. And really, to me, that's what it's about, trying to get as many people vaccinated as possible. And I do want to, again, reiterate that I'm so happy for this forum, this opportunity to really connect and touch the community. Because from the beginning of this pandemic, there's been tons of misinformation, untruths out there. And because COVID was no doubt affecting our communities of color disproportionately, it was very important to me that I had the opportunity to be a source of truth and share facts so that people had the correct information so that they can do what was best for themselves based on facts and not fear. So I've been very verbal during this entire pandemic, and I again appreciate this opportunity. So when you take mistruths, untruths, conspiracy theories, and layer them on top of medical mistrust or righteous displeasure with the healthcare establishment, like many of our communities of color have, to me, that is a concerning combination for detriment. There's an opportunity for more of us to be left behind. That gap is going to widen, and we're going to see more healthcare disparities. It's going to widen who's well and who's not well, who benefits from medical advances and who does not benefit from medical advances. So that's my why. I really want to share a couple of truths, and I'll try not to be long for the sake of our other panelists. But number one, COVID kills. COVID makes people sick. Number two, studies show that vaccines are safe. Number three, studies show that vaccines are effective at preventing COVID-19. And number four, there are some effects which are expected, which means your immune system is doing what it's supposed to do, gearing up to fight off COVID-19 if you're ever exposed to it, meaning you won't get sick from it. And then going back to the next number, COVID-19 kills. And then finally, I'm not taking my chances with COVID-19, and I don't want any of my people to take any chances with COVID-19. So I do want to highlight that it's so important that as many people that can get vaccinated, take that opportunity to take your shot. Okay, because the only way that we're ever going to get beyond this is just like Dr. Lowry said, rejoining our churches, our schools, getting back to normalcy, is if as many people as possible build up this immunity to COVID-19. And the safest way to do this, think about those 300,000 people that have died in the US already. The safest way to do this is by vaccination. So that's my cause today, and I'm excited to answer any questions later.
So, Dr. Bragg, before we move from you, I know you talked about some of the mistruths, and I know you've been very vocal in acknowledging the history of medical racism. And I know we could be here all day. So, just in about a minute or so, how do we take that into consideration as we move forward with the knowledge that COVID-19 has disproportionately harmed people of color?
Today is a new day, Dr. Lowry. Healthcare disparities are not new. Black and brown people have been sicker from common illnesses. They've been dying more. And COVID-19 isn't new, but what is new is that the world is watching. Everybody is kind of waking up. And now the healthcare establishments, the community leaders, we're all taking responsibility to fix these healthcare disparities. And to me, rolling out COVID-19 and making sure that our communities of color have access is that opportunity to right some wrongs, to make sure that people like myself, like my husband, have these opportunities to benefit from these medical advances. Now, you talked about the history of racism in medicine and mistreatment and using Blacks for experimentation. Well, back then we weren't benefiting from the benefits of medicine. Now we're saying, let's look at who's more at risk and let those people benefit. So that's the difference. And I do want to highlight, if it was not safe, if we had major concerns, we wouldn't be putting our frontline workers at risk. Because without us, honestly, it's going to be hard to take care of sick people without the appropriate physicians and nurses and respiratory techs and, all the medical care people. So the fact that the vaccine has been given already to millions of people with no significant side effects and no vision for anticipated long-term effects, I think we need to be work on just having a little faith in people like you and I and the other people on the panel that has done the hard work of investigating all of this, studying this stuff. So just how we are, I guess we're just asking for a little faith in us as well, and look at the individuals that's really pulling and advocating for you instead of the history and the systemic issues that we know exist. We got to start somewhere with working on these things. And I think vaccination and access is the best part, perfect start.
Thank you. Thank you so much. Thank you, Dr. Bragg. I'm going to turn to our next panelist, Mr. Maurice Burton. Can you share why you intend to get the vaccine, or if you've been vaccinated? And can you share with us the why? Do you think it was more personal or a more professional decision?
Well, I thank you for that opportunity to answer that question. It was personal, and a lot of things that Dr. Bragg has shared, I share also. But it came first in the church when our presiding bishop of our church passed of COVID, and then one of our elders was one of the first ones in Berrien County passed of the COVID #1. So it started to hit home, and then it riddled my family with the COVID. So it became personal. And then when I talked to some of the people in the community, and even some of the ones that worked right there at Spectrum Lakeland that worked, and said, well, Trooper Burton, if you take it, you let me know how that goes. But right now they had some skepticism of taking the vaccine. I haven't had it, but I'm encouraging everyone. My mom, she's on chart taking the vaccine, and my dad, he's in the nursing home, and I know I can't see him unless I take the vaccine. My brother's in a nursing home. He took the vaccine, and those are some of the steps I know in order to go see them would have to take the vaccine. So it's a personal thing that I really feel that in our community, we get over the scare factor and understand that this vaccine is there to assist us in our everyday life, and it's no more than the shots that we had to take in order to go to school and be in the public. So right now, that's my main concern, is try to encourage everyone, to not be afraid of stepping out and taking that vaccine when it's your turn to take it.
Thank you. And it's that personal sacrifice that we're making, that we want to keep our loved ones safe. And again, as a retired state trooper after 31 years of service, you're very involved in various organizations. You commented on the personal aspect of why you feel that we should take the vaccine. And you have been very adamant that this conversation needed to happen in our Black and Brown and underserved communities. Can you share a little bit more additionally how you have voiced support for vaccines in light of people and some of the concerns that they presented? And what feedback have you had?
Well, my concern in the Black and Brown community is that we've had so many challenges and so many things that have come before us that, they look at us sometimes, or some of us look at it as being, I don't want to be the first test, since the vaccine came out so quick. They have a reluctancy of wanting to take that because they don't want to be the guinea pig. And that goes back from history in the past. And sometimes, we think of people that want to dwell on the bad things or the bad side effects that may have happened to one individual. And everyone thinks it could happen to them also. But when we look at the scenario of what's going on and conversations that we've had in the Benton Harbor community, it's just a lack of knowledge and education about the vaccine. And I feel right now that demand in Berrien County for the vaccine is going up more. So that's a good thing. And I feel that long as Lakeland and Berrien County Health Department are working together, I think we can turn this thing around for getting people in the Black and Brown community to step out. And that's why I reach out to Dr. Lynn Todman to see if we can do this type of on-site to promote the positive nature of taking this vaccine and how important it is. And we're going to have working on some things right now with the clinic at the Genesis Outreach Development to do a weekend vaccine. And we'll have some further information on that at a later date. But I'm looking forward to rolling up my sleeves and tooting the horn and letting the people in the community know as much as I can to take that vaccine. And when it's my turn, I told them I'd give them a blow-by-blow shot how I feel after the vaccine.
Perfect. We thank you for your advocacy and your outreach. So I'm going to our next panelist, Pastor Jaime Cervantes. You've been the pastor of First Church of God for a couple of years now in the neighborhood of Benton Heights in Benton Harbor. Can you please describe your congregation?
Sure. Thank you, Dr. Lowry. So I have been there for almost 2 years now, and I'll start by kind of describing the demographic in that community. So Benton Heights is this little pocket in Benton Harbor. It's a little bit different demographic-wise, and I would say that it is about 50% African-American. We've got maybe about 30% Latino, and somewhere between 20-25% white, but it is predominantly a community of color. More than half of the residents in Benton Heights live below the poverty line. Our congregation is slowly beginning to reflect the demographic around. I always say that Benton Heights, the church, is a church in the community. It's becoming now a church of the community. So yes, there's a different demographic out at Heights than the larger Benton Harbor.
Great. Well, thank you. So I don't know if you've been vaccinated or planning on becoming vaccinated, but if so, what is your why? And how are you working to persuade members of your faith community who may be hesitant to get the vaccine?
Great question. So I have not been vaccinated, but I intend to do so as soon as possible. There are personal and then there are professional reasons why. But personally, I know that people of color are disproportionately affected. I am a Latino man, so I want to be vaccinated. But as professionally, as a pastor, you can imagine I'm in contact with people, many people. Part of ministering to people is to be present and in proximity to them. And so it would be wise of me, not just for myself, for my family, but for those that I minister to, that I get vaccinated. It is very, very important. And to the people in my congregation and in my community, I think getting vaccinated means we get back to normal sooner. It means we get back to work and we get back to school and we get back into our rhythm. It means that we can now plan things and actually, put resources forward and make plans on the calendar and write it in pen rather than pencil. It means that we can begin to minister and really serve our community in Heights that is so underserved. And lastly, I would say that it means we save lives. And at the end of the day, that's what this is about. It is about saving lives. And Benton Heights, I'll finish my answer with this. This community was already in a public health crisis long before COVID showed up. The numbers, mortality rates are alarming. Hypertension, diabetes, cardiovascular issues, these are all very high in that community. And so COVID would have a catastrophic impact on the Heights. And so I think it's really important for us as a church to be good neighbors to the people in our community.
Yeah, you make a good point, because some of the things we like, not just going to church, but that fellowship and outreach, we can't even do that, And so I see my few people from our church congregation here or there, but I know that's very important, especially to our seniors. That's a part of their socialization. So thank you for your advocacy and outreach. So we're going to turn to our other pastor on the panel, Reverend Earl.
Mm-hmm.
As pastor of New Hope Baptist Church in Grand Rapids, a pinnacle staple of the city, live in the heart of the city, serving a broad spectrum of families, can you describe your congregation?
Yes, our congregation we're probably 97, 98, 99% African American, but our church is located right in the center of Grand Rapids. We are approximately, we're just about 5 minutes south of downtown. We are within walking distance, really. It's a long walk, but a walk from downtown. But in the zip code 49507, I describe it kind of as ground zero for a number of disparities in the Grand Rapids community. In 49507, there's the highest rate of infant mortality. There's a lot of poverty, low-income families. Within our congregation has a little bit of everybody. We draw people from across Kent County. And so we see people from all walks of life, whether they are parishioners who come in on Sundays or through some of our various ministry initiatives and programming throughout the year. We have tried to build our ministry such that we see ourselves as an asset and resource to our community. And so rather than being just a congregation for and a closed community, we're not like a country club. We really try to have presence and do ministry right where we're located.
Great. Thank you, Reverend Earl. And so I don't know if you've been vaccinated or if your thoughts about getting vaccinated, but could you, similarly to Reverend Cervantes, share with us your why and how you plan on working with members in your faith community who might be hesitant to get the vaccination?
Yes, I have not been vaccinated yet, but it is definitely, I plan to be vaccinated as soon as possible. I'm not a first responder. I don't work in the health field, so I was not in that group that could be vaccinated first. But I am, to my knowledge, I've taken the first step, and that was completing the survey, the questionnaire on the My Chart that Spectrum Health sent out. My doctor is in the Spectrum system, so I'm just waiting for. I tell people I'm just waiting for my turn when I'm eligible, when I can take the vaccination. And it's important for me for a number of reasons. Personally, for the obvious, I want to be as safe as possible. Like Pastor Jaime said, working in ministry, you come in contact with a lot of people. And I remember the weekend that the governor had pretty much closed everything down in March. I did a funeral in Holland, Michigan. And I just remember the feeling of the how frightening it was to walk into a room of 200 plus people and to do a funeral. And this was before any of the science about mask wearing and any of that was out there. In fact, there weren't even, I don't know if we had a confirmed death yet in our city, but to all of the people that I tried to stay away from people, but people still approached me. And, a funeral is a very emotional time, and the spouse of the deceased was a member of our church, and to feel the awkwardness of wondering, should I hug this person? Should I not hug this person? Should I give him an elbow or a fist bump? Or so definitely, I want to still continue to be as present, as engaging as possible. But I think that it's just good stewardship of my own health to be as healthy as possible. And then also for the sake of my family, I have senior age parents who I take care of. And then, I have children in my home. And so I just want to make sure that I can do everything that I can to make sure that I can be as healthy as I can. And the way I see it, while there are some perceived, I guess, risks around taking the vaccine, and whatever those risks may be, they pale in comparison to the risk of the real threat that the virus poses. And so either I take this minimal risk of adverse reaction to the vaccine, or I continue to just, be completely unprotected, in the world. So, I would love to return back to as much of a state of normalcy as possible. And I know that reaching this level of herd immunity is going to be important. And so I consider that part of my ministry is to lead by example, but also to try my best to disarm our people with, and to assure them that there are no plots and evil schemes to, use us as guinea pigs and all of that. But it is truly, this is our time and our season to participate in this truly humanitarian effort to ensure health, regardless of color or socioeconomic status or anything like that. So, those are some reasons why it's important to me.
Thank you.
The question I did a lot.
No, you did. I mean, as someone, you hit on so many points, and I was nodding my head because I'm a product of the 49507 community. My parents still live there. I want to get the shot so I'll be able to hug my daddy and be like, "Hey, Dad," versus like just kind of nudging him. So all those, I've unfortunately had 2 funerals of family members during this time, and just kind of navigating that. I mean, we were blessed that they weren't from COVID, but you're kind of like, okay, I'm not gonna hug you, but then when the person, so all those things. So thank you for really speaking that and making it personal, what we in our community are dealing with. Thank you so much, Reverend Earl. I'm going to turn it over to now Dr. Lynn Todman. I don't know, have you gotten the vaccination? And when did you get vaccinated? And if so, how was your experience?
Thank you, Dr. Lowry. Yes, I have been vaccinated. I was vaccinated. I got the first dose of the Pfizer vaccine about 10 days ago. And I will tell you, I had a struggle between my heart and my brain. My brain said, this is the right thing to do. I understood enough of the science. I understood just enough of the vaccine development process to know that it was safe. But then my heart, I struggled with my heart. It was like, are you going to be okay as an African-American person in a health system? And so ultimately my brain won out. But yes, I did have my first dose, and I'll have the second dose in a couple of weeks. And I've had, aside from a little soreness at the point of injection, I've had no side effects.
Very good. Thank you. So let's talk about Spectrum Health and how Spectrum Health is working to connect with our Black, Latino, Hispanic, and underrepresented populations so that we can get them to be one of the 7 million people to get vaccinated.
Yeah, so we have a process. It's actually in flight. We're developing it now, but it's based on the idea of identifying individuals like Mr. Burton in community to help us develop communication around the vaccine, to answer the very specific questions that people have. This panel is an example of that. And then to develop communication vehicles, like how people want to be communicated with, because in many of our Black and Brown communities, the vehicles that health systems typically use don't reach these individuals. These individuals have different ways they like to or prefer to communicate. So that's one arm of the work that we're doing. Another is identifying locations in these communities that are easily accessible to people. So Mr. Bird spoke about a possible place that's incubating now. There are like 2 or 3 other places we're thinking about in and around, for instance, the Benton Harbor community, so that people can have more easy access to it. And the third thing we're doing is the process of registering for the vaccine is a barrier to many people in the Black and Brown community. They don't have MyChart, or they don't have internet to actually register on MyChart. So we're thinking through, what does a process look like to enable better access for Black and Brown people. For instance, my staff got on the phone the other day and called 50 people and got them registered. So we had their phone numbers, because these individuals prefer to phone. So we just set up a call bank and got 40 people registered, 40 people in Benton Harbor registered for the vaccine, people who qualified over the age of 75, for instance. So those are some of the things that Spectrum Health Lakeland is doing to address the need for vaccines in Benton Harbor.
Yeah. And thank you for speaking to the honesty and truth that we know this is not an easy rollout process. I mean, I've even spoken to some of the leadership about getting my family signed up. I was like, well, they don't have MyChart, and how do I get my, parents and signed up? And then I think as we talk about community and outreach, and so let's be honest, this is, as you said so eloquently, a process in flight that we're working and trying to be strategic about. For example, in Grand Rapids, not everyone wants to come downtown. And then, getting out into community, like Mr. Burton said, working with the Genesis Project. So thank you for being so honest and transparent that we're working on it. Thank you. I'm going to go back to you, Dr. Bragg, just because there's some questions I want to take that's been coming in from the social media. And we need to realize, and we talk about the safety of the vaccine. And one of the things I also want to highlight is the National Medical Association, which is the association for physicians of color, specifically of those of African American and African descent. They have come out overwhelmingly saying we need to get this vaccination. Our communities of our brown and Black communities need to get this vaccination. In addition, they have been involved with, from the start, design and research design and looking at the data. And there have been, at least what I've been told and read, at least 10% of the people involved in the studies were African American. So we know that this is a vaccine. It is not without, the sore arm, or as Dr. Bragg mentioned, the second shot, you may feel a little more uncomfortable. which we know is a good sign. We hate to say it, but as doctors, that's a good sign. It means your immune system is revving up. So no one likes to hear that, but a little secret sauce there. So I'm gonna, Dr. Bragg. Let's say, let me see there was one thing that the question was, can you speak on the components of the vaccination or the ingredients per se?
I will say, as a clinical physician, I'm going to stay in my lane. That is to a scientific level that I'm sorry, my battery. That's to a scientific level that many of us don't get into the weeds with. Just like I can tell you about Tylenol, but I can't tell you all about the ingredients and the additives, but I can tell you the mechanism of action and how it works. Same with Cheetos. I have no idea what those ingredients are, but I can tell you the mechanism of action and how it works. So I want people to have a little trust in all the layers of the scientific community. So I will say it is a new type of vaccine. It's an mRNA type of vaccine, which is new to this purpose, but the science behind mRNA vaccines has been tested on other things as well in the past. So they did all this scientific testing in the first steps of the clinical trials before it even came to us. So there's that layer of a whole bunch of background work that we didn't get to see, but it is there. If you are interested, you can look up these studies. I will say that the mRNA vaccine cannot alter your DNA. I know that's a concern. There has not been any significant allergic reactions other than the few that was documented in Europe. So now in America, we have tons of people, millions of people that's now been vaccinated, and there's been no adverse events that's been documented. So no, I can't tell you exactly the ingredients or the components, but I can say that they've been proven through lots of studies including people of color and people with chronic medical conditions like diabetes, hypertension, and it has been shown to be safe and effective.
Good. Thank you. And I think that also gets to one of the other questions that talks about chronic conditions and making sure we address those in not just people of color, but white individuals, and that it is not a forgotten population. The other thing is, and I don't know if, and I will say Dr. Bragg, but if anyone on the panel wants to comment on this, are we seeing any measurable responses from Black and brown populations, either in Benton Harbor or elsewhere, about getting the vaccine? I will say anecdotally, I think we're overwhelmed that people are wanting to get the vaccine, but I'll pause and let anyone from the panel comment on that if they would like to.
Sure, I'd like to. I think there is a hesitancy with some individuals in our community to get vaccinated, and I think it goes back to the level of myths and disinformation that's out there. And so there are myths. And I think the one that I've heard over and over is this idea that the vaccine was developed too quickly. And that somehow that means that clinical trials were rushed. And I think we need to really make an effort to get good information to fight misinformation, because the research and development we know was what was rushed. There was a lot of resources put into it. We know that that the red tape and those things were kind of pushed through, but the clinical trials were not. And so that's the big myth that I have heard. I think the name warp speed might also, maybe wasn't the best name was not the best name for this undertaking, but that's the thing that I'm hearing the most. And I'm also hearing things like, if you have underlying conditions, you shouldn't get the vaccine, or that the vaccine itself gives you the virus. I've heard that from some people. And so it's really important to just get good information out to people. And I want to take this opportunity to also say this. Part of the hesitancy is not just the misinformation, but it's also that there is kind of a history, respectfully, there is a history of distrust, and that has existed not just with government agencies, but with healthcare systems in our populations of color. That's just true. And so it is critical. I think that the vaccination process offers a really good opportunity to change that narrative, but it's going to require transparency, and it's going to require equity with the distribution of the vaccine. And so, no pressure, guys, no pressure, but there is some truth to that. I think there's distrust, and so there's an opportunity here to change that narrative, and I hope that happens.
Yep, very good point. I mean, and just to reiterate, the vaccine is not a live vaccination. It does not give you COVID. It basically, lets your body like mimic the symptoms, and so you can develop antibodies for COVID to fight off the COVID virus. So yes, so I'm going to pause. Would anyone else like to comment?
I will just say, I often hear people talk about trusting healthcare systems and trusting the vaccine. And I think I like to reframe that. We have to become trustworthy, right? So the distrust is a perfectly rational response to not only history, but to what we see today. We hear stories all the time today. So I think we need to think of how, and this is a great opportunity, like how as health systems do we become worthy of the trust that communities might give us? And so I think that's an important nuance in this discussion around trust and in these institutions.
Very good point. Anyone else of our awesome panel like to comment on either the trust issue or other hesitancies in the community?
Yeah, I think a lot of the hesitancy is logistics, how it's set up, not knowing where to go, not exactly knowing how to go in to my chart or whatever's out there to get them to the location. I think transportation a lot of times is a negative aspect in getting to that point. And then how long will it take, to get, the vaccination and being able to go back for the second time. Those are some hindering blocks for a lot of people, and especially during this time of the year. It's cold outside, and some of the elderly people, they're just not going to go out when it's cold. And, that's something that we have to face. And maybe we can get some nurses to go in home once they register. Just think of another way of reaching out and trying to get the individuals to get vaccinated as soon as possible.
Very good. Any other thoughts on things that we could do collectively to break through and persuade people to get vaccinated? Any thoughts?
I would like to, if for the Spectrum people, if you all could speak to a little bit about what the actual process is. There's not a whole lot of information out there about, while we're hearing network television and the news saying that the vaccines are available, they've been shipped. We know that they are in our communities, but we're not hearing a whole lot about where you can go. They tell you don't call your doctor. You can't just call and say, it's time for my flu shot. I can't go to Walgreens yet and get vaccinated. But what is to be expected? Kind of what is the process? I've been hearing some say that you'll get inoculated, and then you'll have to wait for a few minutes to see if there are any adverse reactions, and then, how do we keep from our communities becoming like what we see happening in Florida, where there are senior adults who are sitting in their cars for hours, or people camping out overnight? And how do we prevent that from happening? What are the steps being taken? Can anybody shed any light on that?
I can go with that. I think it's really important to follow the news and watch the groups that are rolling out because this is a very systematic approach based on the highest risk individuals. So we're now in the process of opening up to individuals over 65, and healthcare workers is mostly complete but ongoing. But for the people in the community, so number one is watching for your group to come up. Number two is because this all happened so fast, it was important to get a process that we can reach a lot of people widely at first. And one of the quickest and easiest things to do, not the most complete yet, but was to roll it out electronically. Many of us have been electronic savvy, given that this is our mode of connection right now. And it's been the same with doctor's office. So with Spectrum Health, as a Spectrum Health patient, if you are registered with an account, you can either sign up for My Health, the Spectrum Health app. You can do that on the computer and use your desktop, or you can use your smart device. And then there you have to go into My Chart. My Chart is just the electronic platform. Believe it or not, it's as simple as Facebook, but you go in and you can communicate with your doctors, you can communicate with your own lab results and get all of your information. But basically, there's a questionnaire there. It's a little icon that says questionnaire. You go and you complete the questionnaire. It's a series of questions that ask questions about you, like your age, your occupation, whether you have health conditions, and they use that information to prioritize you based on the groups that they're currently working at. After that, that's all you do, and you watch and you wait, and then you'll get an email notification saying, "Hey, go to your My Chart, and we can schedule you now." So you go and you schedule. That process literally takes a few clicks, and you're done. You'll have a number of options that's available to you. Say Friday is your day, you'll get several times there, and then you'll get information on what happens. It's pretty fresh for me from a patient standpoint, because like I said, my husband just got it this morning. So he saw on the news that frontline workers, like educators, would be able to have it. So he went to his My Chart. He registered on a Friday night. He filled out the questionnaire. He got a message Sunday saying, "Hey, you can reach back and schedule." He scheduled it. So now Friday, he just got the vaccine. He told me he pulled up. It was very organized. He checked in. It was a series of processes. He went, got his shot in the arm. They made him wait for 15 minutes so they can observe him and assure that he didn't have any of those immediate reactions like a significant allergy. And then he came home. At that time, they also scheduled him for the second dose. For Moderna, is 28 days after the initial dose. For Pfizer, is 21 days after initial dose. Most of the people in the community will probably get the Moderna vaccine. Not much difference between the two. So that's where we start. And then, like Dr. Todman said, the healthcare folks are getting savvy with how can we reach these people. We're looking at mobile clinics in the future. Pastor Earl, you may know something about that. We're looking at, calling people like Dr. Todman's folks did, calling the elderly population that we know they fit this criteria and it's urgent for them to get vaccinated. And there's going to be other outreach as we expand. But right now we are limited by supply. So as the supply ramps up again, that scheduling is going to ramp up again. But anybody can complete the questionnaire now. So if there's a delay between your questionnaire and you getting called for scheduling, that's okay. We're at the mercy of how many doses we have. Okay, so I do encourage everybody to reach out to your kids, your teenagers, your grandchildren. These kids can do everything with the computer. We got 2-year-olds that can navigate finding their favorite videos on YouTube. Most definitely, you can get the younger generation to help out the older generation. We all got to rally as a community. We got to help each other. We got to pull people along. And if we see people that's lagging behind, be like, Mr. Burton and do something. Be like these pastors and do something. So it's about all of us working together to make sure everybody is touched positively by this medical advancement.
I think, Dr. Bragg, thank you. You have a great point. And there was a comment in the chat just talking about how we can reach out to our communities and neighbors and families and help register. And, there's probably some young people that are sitting around not doing their virtual school or finishing with their school that can kind of help you register, set up a My Chart. And we know that's not going to impact everybody. So as we mentioned earlier, we are creating this and we know that's not going to be the best way for everybody. And so we're trying to work collectively with our health institutions and individual health departments to roll this out. Does anyone else have an additional comment? I do want to, there was a discussion and it kind of goes along with some of the things that we've been talking about with medical racism and people feel like they've been experimented on. And I want to address the fact that using immunizations to chip people, track people, implant people. That is a rumor. And unfortunately, I have had many people even COVID vaccination say, I don't want to get a vaccine. I think it's a government conspiracy. That's just the way. People have also asked about various types of birth control, like the Depo-Provera shot and implants. That's the way people are chipping people. Let me tell you, that is not a way that we're chipping people. News flash, you carry one of the biggest chipping devices. Thank you, Pastor Cervantes. Thank you. That thing that you're on TikTok and Twitter and Snapchat and all those things, and you shopping on the website, Amazon, they're doing more tracking. Why? Think about this. Why, when you go and look at a website for a particular store, then the next thing you see is like all these things. Oh, I didn't even know I wanted them pants. So that's where we're chipping you. That's how they're tracking you. The government is not tracking you through vaccinations and all these things.
Dr. Lowry, we got chipped. We got chipped like 10 years ago. That rumor is so late. That was like 10 years ago.
Thank you. And then, and newsflash, they're making you every few years get a new chip because they be like, oh, look at this one. Look at that one. So if anyone else, let me see. No, we don't know. We don't also know how much we're getting in vaccine right now. That is one of the bottlenecks. We don't control, how much vaccination we're getting in. So we can literally be, we can get 30,000 shots one day when we're expecting 20, and then the next day get 10,000 when we're expecting 30,000. So that is something, and I'm sure, not getting super political, that a lot of people are saying that's where we're kind of missing the boat. Let me see. There's a question. Are there any vaccines being wasted or just sitting in our community?
I think we've been very fortunate as a healthcare system. You look at the big three here in Grand Rapids with Spectrum Health, Metro Health, and Mercy Health. Blessed to have colleagues and friends throughout all these healthcare systems. And we've been able to roll out this process so efficiently and effectively that those that can, many of them did. And we are going through that supply. And as we opened it up, that supply is so we don't have vaccine just sitting, which is great. I know people in other states, even 2 hours away on the east side of the state, where the process is not as easy. So we're fortunate that we have a lot of good people working hard on the logistical side of things, where we don't just have vaccines sitting.
Thank you. Another question that's come in, and please keep your questions going. I love the dialogue. If transportation is an issue, has there been any discussion about soliciting volunteers who will be willing to drive people to a location to get vaccinated once they're registered?
I'd like to kind of piggyback on that, if I may, Dr. Lowry. That is one of the biggest barriers out in the Benton Heights community, and I would say in Benton Harbor at large, is transportation. It's one of the big barriers for people in our community. And so, the suggestion here is, will people be transported? I don't know. Maybe the answer is to bring the vaccine into the community and have set up places where that can happen inside of the community. So it's in proximity to them rather than expecting people in the wintertime to make it out to wherever the sites are. So I think that's a really, really good question.
I can take this on a little bit because so that's where we need our community partners to really step up and help us think this through. There's so many resources in the Black and Brown, the Spanish-speaking community that need to be at the table. Folks who understand how these communities roll, like what are the priorities? Where do people show up? How do they want to be served? So certainly for Spectrum Health Lakeland, we are looking for these partners to help us think this through. And Pastor Cervantes, that's exactly right. Our strategy is more focused on going where people are as opposed to asking them always to come to us. And that isn't just physically, but also the processes. Create processes that meet people where they are versus saying, these are the processes we use and this is how you're going to have to do it, which is kind of where we've started today because we had to go really fast, so we had to use established processes. But I would say our community partners are going to be really, really important in helping us think through how to get the vaccines to people in ways that make sense, including the transportation issue.
If I can just add to that, that's one of the things that we're working on in Benton Harbor, Benton Heights there, Pastor, is to get the transportation. At our Genesis building, we have a bus and van, and I'm working with some drivers and working with Lakeland, and we're working on the logistics of being able to even bring them out to a clinic if once we get that set up at a future date so that they can, those that need transportation can. We did that during the time of COVID when we had to get lunch to the kids in the community and dinner to the kids in the community. So I'm with Dr. Todman. It takes a collective group of everyone working together to make that happen. And I believe it could happen if we all get together and sit at the table and work the logistics and plans out. But it's forthcoming.
And thank you, Reverend Cervantes, for even saying you would volunteer your ministry center. And again, that's what we need those innovations again, and minds. And please feel free. I'll say, if you have a great idea, you can feel free to reach out to me because we're all in this together. And it's just not we can set up a vaccination location. We also have to remember we have to socially distance. We have to make sure we have all the equipment together. We have to make sure we're not impeding traffic flow and all these things. Not that it cannot be done. It can be done and it will be done. But again, there are so many barriers here in this, and I didn't want to use this, but unprecedented time. There are so many there's so many barriers out there that we ask for our community partnerships, and we will continue to ask for advocates and just be forward thinking. Any other comments on any collaborative partnerships, how we can all work together as a community to amplify our message about getting the vaccination out and keeping our community safe? Any final words?
So I just want to thank Spectrum Health for this, the Healthy Communities Initiative, and New Hope Baptist Church. From what I understand, we are partnering with Spectrum Health, and we will be hosting a vaccination clinic. So that'll be right here in 49507. I asked the questions about the process because I know that there are going to be a lot of people who are not capable of navigating my chart. I don't know all of the logistics. I'm going to go out on a limb and say that the date is next Thursday, January 21st, from 7 a.m. to 7 p.m. But again, if I know when I put that out there, there's the risk of, all of the city showing up. But I believe, though, that the information just needs to be shared. So can you all speak to what are the advanced steps that people can take besides going into my chart? How can they prepare for any vaccination clinics that will be promoted in other locations besides just here or anywhere else around the city.
Dr. Todman, do you want to speak to that?
Okay, I thought you were talking about Grand Rapids.
I'm just anywhere. So I don't know if it's going to be the same, but to my knowledge right now, this is one of the first vaccination clinics outside of Spectrum Health facility that I'm aware of. So what are the steps that people need to take to, I don't want people to come here and be turned.
The best thing that I can say, because this literally is in flight, for instance, I'm getting texts like right now on the dosages that are showing up in Marion County, and I'm trying to find out, can I talk about this? We are identifying large sites where we can do this. In advance, I think the best thing folks can do is pay attention, because we're working really closely with the Marion County Health Department on the community sites, is to pay attention to the health department's website. Like, check it every day to see when sites are going to be put up. We're very close to actually nailing some decisions. And I know that they will show up on the Marion County website of where these locations will be. That's the only way I can think of right now that people can prep. But just to be constantly vigilant by checking out the websites where we're going to be, where we will put the information as soon as it's available. But there's nothing in terms of protocol that you have to do to prepare.
I will say, just don't show up, because that's when you're going to get turned away. I mean, there is a finite number of doses at each facility, because they have to be frozen and defrosted and used within a set period of time. So the number of doses that people have is specific to the number of people that are registered. So you have to register and complete that process. So again, reach out to somebody that can help you with that technological aspect, even if it's a matter of going somewhere where internet is offered and getting help. That's just what we got to do until we develop more solutions like we're actively working on.
Yeah, that's a good point. Don't just show up.
Is the registration process, that's the thing. There's no talk about registration. Is registration only happening in my chart?
It's only happening in my chart unless you're notified by some of these other solutions that we're working through, like Dr. Todman mentioned. But right now, probably for your population that's going to be at that clinic, it is only my chart. Everybody must fill out the questionnaire. Everybody must have an appointment. The site of where you go will depend on what happens when they schedule with you. So whether it's at one of the clinic sites or one of the community sites, that's the part where your location will likely come into. So my chart right now, until we figure out more solutions, is the answer. That's the key to getting your vaccine.
And we've been working collaboratively with Dr. Nirali Bora and the Kent County Health Department. So, you know what? This is such great conversation and engagement, and the time just flew by. Again, I want to thank our great dynamic, impassioned panelists. I also want to thank you all for joining us for Spectrum Health's ongoing series, COVID-19 Vaccines and Our Communities. We appreciate, I just got an alert that Spectrum Health just got a notification that Spectrum Health
so
Lakeland got 900.
Yes, but it's a registration process.
So that's a
registration process.
So you got to do so remember, you got to do that registration process. I will say you can help somebody register, like on the phone. So you can help a family member register. You can do that if you're on your laptop or smart device, you can help that family member join. We know it's not perfect. Hopefully, as time goes on, we can have something that's a little more less electronic heavy, but that's kind of where we are right now. We appreciate our panelists for sharing their time, their expertise, their passion, their advocacy. We plan on sharing the recording on our website, spectrumhealth.org, where you can find many resources to help you and your families stay healthy. Thank you and have a great afternoon.
Thank you.
Thank you.